Do you have a painful red eye and have noticed that you have become very sensitive to lights? You could have a condition that is called uveitis or iritis. In this video, I will teach you about what uveitis is, what some of the causes are, what the symptoms that you may experience are, and how the condition is treated. Welcome back to my channel. My name is Dr. Shaz Rehan and I am a medical doctor currently training to be an eye surgeon. This eye education platform, the Rehan Ophthalmology Academy, is designed to serve as a hub and teach about eye related matters to everybody anywhere. As with all of my videos, in order to keep you interested and in order to facilitate your learning, I will present several questions throughout the video in order to test your knowledge. There's no need to panic. The questions are very straightforward and all of the answers are contained within the video itself. So please keep watching until the very end. As with all startup channels, it is very important to us to have the support of our viewers. So please do subscribe to my channel if you find my content of interest to you. The first thing we will talk about is what uveitis or iritis actually is. In order to understand this better, we must first understand that the eyeball is actually made up of three distinct layers. These distinct layers are the outer thick connective tissue layer, which is the sclera, which is the white part of our eyes. There is then contained within the middle a layer which is referred to as the vascular layer, and this is made up of the iris and another component called the ciliary body. And then the innermost layer is the retina, which is involved in the processing of light and visual information. The middle layer of the eye is also known as the uveal layer. Uveitis simply means that this middle layer of the eye is inflamed. When the middle layer of the eye is inflamed towards the front of the eye, or what is called anteriorly, the structure in the eye, which is part of the uvea, is called the iris, and therefore that's why some people refer to uveitis as iritis. If indeed the inflammation is confined to the front of the eye, then this term is correct. However, if the uvea is swollen and inflamed towards the back of the eye, then the term iritis is used incorrectly. The reason why iritis has gained popularity as a phrase is because typically the type of uveitis that occurs in most patients is iritis. Remember, going back to basics, the iris is the colored part of our eyes, and iritis means simply that this layer is inflamed. Iritis can be a terribly troubling condition, and it typically can recur many times in patients, and patients do become very accustomed to detecting the signs and symptoms quite early and therefore seeking help promptly. Iritis is a condition that can affect not only one eye but both eyes. Iritis or uveitis is like many other conditions in medicine, whereby it can come on acutely or it can be a condition which is chronic and lingers for some time. Iritis needs to be treated promptly, because if the inflammation starts to get out of control and travel towards the middle and then the back part of our eyes, it can start to affect our vision. In a significant proportion of patients, in fact in almost half of patients, no cause for the uveitis is actually ever found. In other subgroups of patients, the uveitis can occur and be part of an underlying inflammatory process that may be affecting our bodies. There are well-known links within medicine whereby we can have a general health condition, and as part of that, uveitis can occur. Some of these conditions can include things such as Crohn's disease or ulcerative colitis, things such as sarcoidosis or TB, and also conditions such as ankylosing spondylitis or rheumatoid arthritis. Uveitis can also occur in association with an eye infection, an infection being caused by things such as syphilis or shingles, for example. The list that I have mentioned above is not an exhaustive list of causes of uveitis, but what I have mentioned tends to be some of the more commoner systemic associations of uveitis. If you are finding this video to be of interest, please do kindly subscribe to my channel. It would mean a lot to me. The hallmark typical features of uveitis are a painful red eye, which is associated with an increased sensitivity to light. Depending on whether the uveitis is acute or chronic, the symptoms may come on rather suddenly, or they may develop and increase over time. If the uveitis is affecting one eye, then these symptoms will obviously only be present in the one eye, whereas if the condition is bilateral, meaning affecting both eyes, then it is likely that these symptoms will be present in both of the eyes. Our eyes tend to only respond in a set number of ways when posed with threats such as infections, for example. The reason I am mentioning this is because lots of eye conditions can present in a very similar way, and the differentiating features between them can be quite subtle. That's why it is important to always seek a professional consultation and be advised by your eye care professional. These individuals have the skill and ability to listen to your collection of symptoms to differentiate between the potential different causes of your symptoms, to then diagnose you with what condition you have and to advise you on the appropriate treatment. Iritis is a common condition, and the diagnosis of iritis is done at the slit lamp. Prior to even getting to the slit lamp for an examination, through careful understanding of a patient's history and collection of symptoms, the diagnosis of iritis can usually be tentatively made, particularly if the patient has had attacks of uveitis before. One thing that typically will be apparent to your eye care professional is your aversion to bright lights that are present in the consulting test room. Some patients are terribly troubled by this and do ask their eye care professionals if the lights within the room can be dimmed down or in fact turned off. When your eye care professional examines your eyes at the slit lamp, they are looking for very specific telltale signs that you have iritis. These telltale signs include the presence of cells, which can be seen in this diagram, the presence of what is called keratic precipitates, and this is essentially a collection of white blood cells which come together to form little balls or clumps, and they then get deposited on the front aspect of the eye. Another interesting phenomenon that can occur and can be seen is posterior synechia. Posterior synechia, as can be seen from this diagram, end up distorting the round shape of the pupil. This occurs because the iris, which is the coloured part of our eyes, has stuck to the lens within the eye. This can cause the iris, which is a muscle, to spasm, and this indeed causes a lot of the ocular discomfort that patients experience. Another interesting point to consider at this stage is because the iris is stuck to the lens and it cannot effectively control the aperture and size of the pupil in response to changing light levels. When the light is typically bright in the environment that we are in, our pupils will constrict and get smaller in order to reduce the amount of light getting into the back of our eyes. If this mechanism is not working properly, we get increased light sensitivity. Your eye care professional will also measure the pressure within your eyes, because with certain types of uveitis, particularly infective types, the pressure within your eyes may be higher than it should be. As mentioned in the earlier section, iritis refers to inflammation at the front of our eyes, and this is called anterior uveitis. We can also have intermediate uveitis, which affects the middle part of our eyes, and then we can also have posterior uveitis, which affects the back of our eyes. There is a form of uveitis which is called panuveitis, and in this condition all three sections of our eyes are affected. To facilitate the examination of your eyes and to help towards arriving at a diagnosis, your eye care professional will typically use dilating eye drops in order to have a good look into the back of your eyes. If you remember earlier, I mentioned that uveitis can be associated with underlying health conditions. For this to be investigated thoroughly, there may be a need to do blood tests or to order things such as X-rays. After listening to your story and your history, your eye care professional will advise you on whether these investigations are indeed necessary for you. Some of the indications for needing to do blood tests are frequent attacks, presenting with uveitis for the first time in both eyes, and within your history if you have the presence of certain symptoms and or signs that are suggestive of an underlying health condition. If you are diagnosed with uveitis, then usually you will need to commence a couple of eye drops. As with inflammation in any other part of our body, inflammation requires treatment with steroids. Depending on the severity of your uveitis, which will be graded by your eye care professional, your steroid regime will be advised to you. A mild form of uveitis may only require the use of a steroid eye drop 4 times a day for 1 week, and then 3 times a day for the following week, and then 2 times a day for the week after that, and then finally 1 times a day for a further week. The reason why steroids are gradually reduced or tapered in this way and fashion is because if this process of reducing the frequency of steroids is accelerated, the condition may be treated suboptimally and can recur. In another example, if a patient presents with quite a severe anterior uveitis, they may need to commence steroid eye drops every hour for the first 2 days, and then reducing this down to every 2 hours for the following 2 days, and then gradually switching over to a 6 times a day regime for 1 week, followed by a 5 times a day regime for the following week, etc. This leads me onto a very important point that I made in another video. In the presence of an acute red eye, it is fundamentally important that an eye care professional sees yourself, because not only will their expertise help to diagnose your condition, they can also advise you on the appropriate treatment and how to carry out that treatment. Self-diagnosing and self-medicating are not good practices. If you recall from the earlier sections of this video, I mentioned that the colored part of our eyes, the iris, can stick to the lens within our eyes, and this can cause issues with light sensitivity and pain. Your eye care professional will therefore typically prescribe you a dilating eye drop. This effectively causes the iris to push away from the central part of the eyes and move out towards the periphery, as can be seen in this diagram. This serves a few purposes. One of the purposes is it helps to relieve the spasm that is occurring within the iris. Secondly, it helps to prevent the formation of the posterior synechii, which is the sticking of the iris to the lens. And thirdly, if you do indeed have these posterior synechii, it can help to break them up. It is important to remember that whilst using these dilated eye drops, your vision will be blurry and you will struggle to see at distance and at near, but particularly at near, because your ability to focus will also be affected. Your steroids during the course of your treatment for uveitis may continue for several weeks. However, the treatment with the dilating eye drop may only be needed for the first week or so. If you recall from the diagnosis section of this video, I mentioned that with uveitis, the pressure within our eyes may indeed be high. If this is the case, then your eye care professional may also prescribe an additional eye drop to try and reduce this pressure. Close follow-ups with your eye care professional during an attack of uveitis are very important. Your eye care professional will check and ensure that the condition is responding to treatment. They will also evaluate and ensure that the condition is not spreading to the middle and possibly the back part of your eye. And they will also keep a close watch on the pressure within your eye. If the pressure within your eye is not high in the first instance due to the uveitis, when one starts steroids, steroids can make the pressure within your eye go high also. There have been concerns centered around whether the use of steroid eye drops can cause conditions such as cataracts and glaucoma. This may be true when the drops are used for very extended periods of time, and I mean years. However, in the short term, for an attack of anterior uveitis, they tend to be fairly safe. However, the flip side of this argument is if steroids are not used to treat anterior uveitis, cataracts and glaucoma through several mechanisms can actually be accelerated and developed by patients. And that is why it is important to seek professional help when you feel you may have anterior uveitis, as your eye care professional will provide you with the regime of steroid eye drops that will provide you with effective treatment for the shortest period of time in order to try and minimize any potential side effects. Some other important things to consider when you are actively treating a uveitis include when your vision is blurry due to you using dilated eye drops, it is advisable not to drive during this period, because if you do drive and you are unfortunate enough to have an accident, your insurance may actually be invalidated. Depending on the severity of your uveitis, your condition may last anywhere between a couple of weeks up to 6 to 8 weeks. However, this will vary on a case-by-case basis. The important point to mention here is once treatment has been commenced, your symptoms will hopefully be alleviated a lot sooner than the condition actually lasts. Other practical aspects that patients may find useful when they do have active uveitis is wearing either sunglasses or wide-brimmed hats. These two components serve as a mechanism to try and reduce the amount of light getting into our eyes. And if you recall from the earlier section within this video, patients with uveitis typically have increased light sensitivity. If your ocular discomfort is also troubling you, your eye care professional may advise over-the-counter analgesics to try and help to combat your symptoms. Anterior uveitis is an inflammation within the eye, not an infection, and it is for this reason that the condition is not contagious. However, it is only when you have the knowledge that you have anterior uveitis that you can rest in comfort about this very point. If you have an uncomfortable red eye and you yourself diagnose it as being an anterior uveitis, when in fact it's actually a viral conjunctivitis that is starting off in one eye and may progress to the second eye, then this notion that your condition is not contagious is actually incorrect. This again, I know I've repeated it a few times within this video, is why it is fundamentally important to always seek professional advice when it comes to any eye complaint or symptom. So this brings us to the end of this video about uveitis. In this video we have discussed what uveitis or iritis actually is, what some of the common causes of this condition are, how the condition is diagnosed, and how the condition is treated, including some practical advice on what to do and what not to do when one has uveitis. My channel is fairly new and therefore your support would be greatly appreciated in order to try and develop my channel. Simple things that you can do to help include subscribing, commenting, liking, and if you feel that you would benefit from future videos that I produce, then definitely click the bell icon in order to stay up to date. I would love to hear from you in the comments section below, and do tell me about your experiences or the experiences of family members with uveitis. When did you get it? Do you know what caused it? Did you get it in one eye? Was it in both eyes? Was it trauma related, which is one of the other causes of uveitis? Was it associated with an underlying health problem? How long did your treatment last for? And have you had it since?